Vaccination in Malawi. Millions of illnesses have been avoided since 1979, when a national routine immunization program was developed in Malawi. The recommended vaccine schedule for children can be found at this link over there in red, or at this website. So here's the schedule of some of the more key vaccinations. The BCG vaccine protects people from the bacteria that cause tuberculosis, and that's given at birth. Rotavirus is the most common cause of gastroenteritis, which is diarrhea, fever, and vomiting, and is highly contagious. Untreated rotavirus infections can lead to dehydration. That's given at 6 weeks and 10 weeks for a child. The pneumococcal conjugate vaccine, pneumo_conjugate, protects against Streptococcus pneumonia, a bacteria that can cause infection of the lungs, blood, or membranes of the nervous system, which is meningitis. That has to be given in 3 doses here at 6, 10, and 14 weeks. This vaccine, with all the letters right here, is a combined vaccine. It protects people from diphtheria, tetanus, and bacteria that can cause ear infections, pertussis, which is whooping cough, and hepatitis B. It is given to a child at 6 weeks, 10 weeks, and 14. Diphtheria is caused by a bacteria which releases a toxin into the bloodstream. It can lead to difficulty breathing, heart failure, paralysis, and even death. Tetanus is caused by this bacteria, which produces a toxin that poisons the nervous system, causing painful muscle contractions that can be life-threatening. Pertussis, or whooping cough, is a lung disease caused by a highly infectious bacteria, Bordetella pertussis. It can be especially dangerous for infants if it causes airways to close. Haemophilus influenza is a type of bacteria that causes colds and ear infections. This is different from the viruses that cause influenza or the flu, which are called H1N1 or H2N3. Hepatitis B is a virus that infects the liver. It usually clears up on its own, but chronic infections can lead to very serious illnesses, requiring a liver transplant for survival. It is spread in bodily fluids. In adults, it is most commonly spread by sexual contact. The measles and rubella, also known as German measles, vaccine protects from 2 viruses. The very infectious morbillivirus causes measles. While most infections cause a rash, cough, and fever and are not serious, they are uncomfortable, some infections can lead to encephalitis, which is inflammation of the brain, which is much more serious. Rubella is caused by rubeviruses. Infections of children and adults usually leads only to rashes and fever, maybe with sore throat and fatigue. However, measles and rubella are very dangerous to the unborn child of an unvaccinated pregnant woman. These viruses can cause miscarriage or stillbirth. Surviving babies may be born with many different birth defects, including brain damage, deafness, and blindness if they infect an early fetus. And this has to be given at 9 months and 15 months of a child's life. Cervical cancer is caused by certain strains of a sexually transmitted virus, human papillomavirus, or HPV. Most strains of HPV cause warts on external sex organs, but 4 strains are dangerous and can cause cervical cancer. The HPV vaccine protects people from all dangerous strains of HPV. While all adolescents should receive the HPV vaccine to prevent spread of the disease, the virus typically causes cancer only in females. The HPV vaccine is extraordinary because it is the only vaccine that can completely prevent a common type of cancer, not just an infection. Other types of cancer have complex sets of causes and are usually not viral. In the past, cancer of the cervix was the most common cancer in Malawi, but that will change as the vaccine is given to all young people in the future. This chart shows the most common types of cancer in Malawian women in 2012. As more people are immunized for HPV, the rate of cancer of the cervix over here will decrease.